Good afternoon, everyone. It's an honor to be here after having heard Honorable Minister Shri J.P. Nadda ji, after having heard our own Professor V.K. Paul ji, to kind of give a concluding remark. Let me start with and try and associate what we've discussed yesterday, today, and how Nadda ji has kind of put it. You know, he spoke about multiple things, but I was trying to kind of club them together so that we can see the impact that India has seen, in the last decade or so. If you today look at the growth in talent, and you know, our industry is talent dependent and nothing else. Take a guess, over the next 7 years, how many doctors will India produce? 1 million doctors, give or take. Find me another country in the world which can have 1 million doctors to enable the health system of a country as vast as ours. It's incredible. And we are today, by the way, it's not small today, we are today the largest health workforce in Asia. Now let me go to the next point that I kind of looked at, infrastructure. Our infrastructure progression is significant. We double, to Professor Paul's point, we double our bed capacity every 7 to 10 years. And honestly, and it's also captured, Nadda Sahab, in the EY report on how sustainability of this infrastructure is going to come in. If you see, and I do actually see that there is sight to enable 600,000 to 700,000 beds over the next 7 years, ably supported by the talent that I spoke about. Because you could have a bed, but unless you have 1 doctor to 1 bed ratio, a bed is not worth. So imagine in every other part of the world, crisis is not the bed. Crisis is to enable that with talent. And we certainly have sight to that talent, coupled with the bed. I'm reasonably sure that we'll get to the number that Professor Paul spoke about. The next part, I think, adequate, it's the access part of it. Again, access is the same story. From 80% to less than 39% in less than a decade. And I see that improving as we go forward. And the last part I think that I want to touch upon, and I know I'm getting, I'm seeing the eyes of Dr. Mahajan there. It's quality, right? We've taught the word frugality, and we are teaching the word quality with frugality to the rest of the world. And that is something that we are enabling. And I have to thank, sir, your leadership, your vision, and that's enabling all of that to happen. So once again, ladies and gentlemen, let's put our hand together for... Come on, that can be louder, yeah. Come on.